Today, on this episode of Riverside Strong, we tackle a very common yet frighteningly serious medical event, the heart attack. We'll learn to recognize the symptoms of a heart attack and how they can differ between men and women. We'll also take a closer look at what a patient experiences when they have a heart attack, from the initial onset of symptoms through the emergency room treatment and the recovery process. Finally, we'll hear from patients and medical experts about what they wish more people understood about heart attacks. This and so much more on this episode of Riverside Strong.
Adversity, disasters, emergencies, crisis. These are not the things that create character. No. These are the times, the moments that reveal character. You know what it also reveals? Compassion, empathy, humor, creativity, innovation, kindness, perseverance, knowledge, and strength. Perhaps strength most of all. We're Riverside Strong.
Welcome to Riverside Strong, where we examine a wide array of medical issues from the points of view of both the patients and the medical professionals who treat them. I'm your host, Ashley Snyder, standing in for Cheryl Nelson. Today, we are taking a closer look at heart attacks. According to the Centers for Disease Control and Prevention, or the CDC, heart disease is the leading cause of death for both men and women in this country. 1 in 4 Americans dies from complications of cardiovascular disease. There are multiple forms of heart disease, but the most common, known as coronary artery disease, affects blood flow to the heart. When that blood flow of oxygen and nutrients to the heart is restricted or blocked, the heart muscle can start to die, causing a heart attack. More than 800,000 Americans have a heart attack every year, with more than 600,000 having one for the first time. During a heart attack, it is critically important to get to a hospital to reestablish blood flow to the heart. But would you recognize the signs of a heart attack if you were having one? You might be surprised at the answer. When we come back, we'll learn just how to recognize symptoms of a heart attack. This episode could save your life or the life of someone you love, so stay tuned.
We're Riverside Strong.
Welcome back to Riverside Strong. Today we are taking a closer look at heart attacks, the symptoms, the treatments, and the recovery process.
Well, the heart muscle has tremendous energy requirements as it's squeezing the blood through the body, 80 times a minute for your entire life. And that the energy that it requires is in the form of oxygen, which is delivered through the bloodstream. And that oxygen is delivered attached to red blood cells through the coronary arteries, the arteries that supply blood flow to the heart muscle. And coronary artery disease is a disease of the wall of the artery where people get a progressive plaquing in the wall of the artery. And a heart attack is where there's often a very sudden change in the coronary anatomy. People who have some degree of plaquing can develop a very sudden inflammation in the wall of the artery. It's interesting, people have measured the temperature in the wall of what we call vulnerable plaques in research, and actually the temperature of that is much warmer than the surrounding tissue. I tell my patients it's very much like a boil in the wall of the artery. And for reasons that are not understood, people get these things, and the end result in that can be heart attack because the boil or the wall of the artery will crack, which we call plaque rupture. And then a cascade of events occurs where platelets or the blood clotting cells start to stick on that plaque. And if it does so to a certain extent, it compromises blood flow down the artery. And in many cases, it completely occludes the artery. And then people present, with symptoms of heart attack, which can vary from person to person. And it's interesting how people can have very stable coronary disease for years, very predictable symptoms. Every time I drag my trash can down to the corner, or down to the curb, I might get tight in my chest. And it's been like that for 10 years. And people can be very stable with medications for that. But yet people can develop very sudden, unstable symptoms, and we remain not great at predicting those events. But they develop oftentimes, a diffuse heaviness in the chest, pressure tightness. It might be very similar to what they've had with exertion, but in terms of quality and location, but it's often more intense, and they can tell that there's a sudden change. And so I always tell my people, it's very acceptable to treat coronary disease medically as long as it's stable. Patients need to know when to call you when things become unstable. They need to know what that means. And the extreme manifestation of that is a heart attack.
Heart attacks can be sneaky, and most don't look like they do in Hollywood, where the hero suddenly clutches their chest and falls to the ground in pain. The actual symptoms are sometimes harder to recognize, and they can even differ between men and women. While people tend to think of men having a heart attack, more women than men experience heart attacks each year, with one woman dying every minute from cardiovascular disease. Cardiovascular disease is actually more deadly for women than men. In fact, women have a higher risk of dying from cardiovascular disease than from all forms of cancer combined. But would you recognize a heart attack? Imagine you were going about your normal day. Maybe you were at the grocery store, taking your kids to soccer, or even giving a presentation at work. You notice you aren't feeling well at all. You've been sluggish all day, and it's only getting worse. You can feel a cold sweat break out. You're nauseous, and you feel like your arm and jaw are hurting. You feel tightness in your chest, but not what you would describe as chest pain. Would you call 911, or would you try to stick it out? Getting the answer right could mean the difference between life and death, which is why everyone should know the symptoms of a heart attack.
My name is Martha Elaine Grady. I live in Smithfield, and in 2011, I had a heart attack. And again, this summer, in June, I had another heart attack. I started having pains go up my arm, and I thought, okay. But they didn't last very long. I mean, not even long enough for me to pick up the phone and call 911. So this kept happening, and I go to the doctor. He sends me to the cardiologist. I go in and have a heart catheterization in 2011. I didn't make it out of the hospital that day.
The symptoms of a heart attack are quite simple, actually. The most common symptom is chest pressure. Most people will hear chest pain, but it's actually chest pressure, a sensation of somebody or something, such as an elephant, sitting on your chest. So that is the most common symptom that most people will experience when having a heart attack. There are other symptoms that do go along with that, such as shortness of breath, feeling hot and sweaty all over, nausea, throwing up, extreme fatigue, and back pain. Women in particular will actually have those other symptoms in addition to chest pressure, which does make it a little more challenging for both the patient and the provider to realize that it is a heart attack because of the other constellation of symptoms. In addition, diabetic patients will also tend to have what we call atypical symptoms, so potentially not the crushing chest pressure in the middle of your chest, but more a heartburn type feeling or a vague overall sense of chest discomfort.
You feel that pain going from up your arm, across your chest, into your neck, in your back. Don't ignore it. Get help. Call 911 if it's bad enough.
It's important to not only recognize the symptoms of a heart attack, but also to call 911. But it's not just to get you to the hospital faster. Why is that? And what actually happens once you arrive at the emergency department? We'll find out when we come back.
We're Riverside Strong.
As you'll hear from Riverside's experts, the ambulance in many ways has become an extension of the emergency department. They don't just keep you alive en route, they are performing EKGs and other assessments and transmitting that information to the hospital so they can assemble the right team of doctors, nurses, techs, and equipment to reestablish blood flow to your heart as quickly as possible. The experience of arriving at the emergency department having a heart attack can feel chaotic, as there are a lot of people rushing around you all at once. But as one physician told us, it is actually a lot like a NASCAR pit crew, where each person has a specific job to do and knows how to do it quickly. But instead of getting a car back on the track, they are trying to get the blood flow to your heart reestablished as quickly as possible. How did they do that? The medical experts at Riverside answer those questions and more.
It's important to call 911 if you think you're having a heart attack, as heart attacks can cause abnormal heart rhythms, which can be life-threatening. In addition, it's a way to identify a heart attack quickly and to ensure when you get to the emergency department that all the people who need to be there are there and we can quickly assess and treat you. So always very important not to drive yourself in case you have one of those abnormal heart rhythms, as they can be fatal, but also to ensure that you get treatment from that first responder who sees you.
If you need to be resuscitated, you want EMS there because they are the extension of the emergency department to bring you life-saving care. 911 will make a decision as to which is the most appropriate hospital for a patient. They will take into account where they're located, where the hospital's located, and how far they are away from a comprehensive center like Riverside Regional. If at all possible, they will bring the patient straight here, because we offer the most advanced techniques to reverse a heart attack. They're in constant contact with us, and they will alert us of your condition, and we can prepare for you before your arrival, and we can mobilize a team which can actually reverse your heart attack upon arrival.
I want to talk to the patient, I want to meet them, but the first thing I want to see is the EKG, so they hand me that when I get there. And as y'all know, EKGs are now done in the field by EMTs. We often know when somebody is having a heart attack before they come in. And in the algorithm of assessing these people with heart attack, that's the first thing we want to decide. Is that person having an ST segment elevation, myocardial infarction or not? And we abbreviate that or shorten that to STEMI, because if we see somebody with a STEMI, there are some very immediate therapies that they get. And then we go straight to the cardiac lab to try to identify and open the artery that is affected. The average person now who gets here quickly and whom we open even a major artery, they leave the hospital with near normal, if not normal, heart pumping function. And if it's not normal when they leave, it often gets better in time if you've opened the artery quickly enough and they've gotten here soon enough. So there's some awesome people who work with us as cardiologists. There's a team of people who are mobilized when there is a STEMI code. The STEMI codes are often in the biggest room of the emergency room because it's a little bit like a NASCAR pit crew. There are a bunch of nurses, they're getting IVs in, and there are a series of medications that those people are given to get them ready to go to the cardiac lab. And then we roll down the hallway and we bring them into the cardiac lab and they slide over to a table. A cath lab table is a little bit like an examination table in a doctor's office. It's thin, it's longer than that, and it's flat. An X-ray camera sits over them. And so as they get the patient hooked up to their machine, they get them off this defibrillator wires, we hook them up to our machine, and then we give a little bit of sedation if their blood pressure allows us to. And then as we're all scrubbed up and we all wear leaded aprons because we're working around radiation all day and there's radiation involved in this technique, we access the artery either in the groin or if they're able to lay still, the radial artery. And either one of those accesses gives me access to the arterial system. And I, with the help of an X-ray camera that sits over their chest, I advance a wire and then a catheter, which is just a long thin tube, up to the coronary artery. Normally from that EKG, I have some idea which artery is involved, and I go straight to that artery. Once we identify the artery, we have these little wires we call guide wires. They're 14 thousandths of an inch in diameter. They're different. They have different makes and different characteristics, but we have a little tip, and at the end of that wire, the part that's sticking out of the patient, I have a little plastic clip on the wire that allows me to turn it through bends. And there might be different views that I'm looking at the artery in to try to identify, where the wire needs to go. What we do at that point depends a little bit. Oftentimes we'll go in with an angioplasty balloon, and the angioplasty balloon, they come in different lengths and different diameters. And so we pick one that we think fits the size of the artery, and we go in and we inflate the balloon, and that often normalizes blood flow down the artery. So the heart attack is effectively over. The tissue is being perfused again, And then I take a few more pictures and decide where and what size stent I'm going to put in. Once we love where it is, we expand the stent with the balloon. Then the balloon is deflated, it's removed, the stent stays in place, serves as a scaffolding to hold the artery open. And so then we complete the case. I might take a look at the ventricle and the heart pumping chamber, measure the pressure around the heart, take a look at all the other arteries, and then we remove the tubes. When the procedure's done, then they go to the cardiac intensive care unit, and they usually spend, if it's all uncomplicated like I spelled out, and their heart pumping function's normal, they usually spend 2 nights in the hospital, and then they go home with appropriate medicines and cardiac rehab and all those kinds of things.
Before he let me go home, he said, it could happen again. And he says, I'm not going to promise you that it won't. He said, it could happen. He says, you know what to do if it does, if you start feeling that pain.
Getting discharged from the hospital is not the end of the recovery process. Instead, it is simply the start of the next phase of healing. That is when the focus shifts to rehabilitating the heart and preventing another cardiac event. Quitting smoking, starting exercise routines, and changing eating habits are all part of the process. Coming up, we'll hear from the Riverside experts who help patients through each stage of the process.
We are Riverside Strong.
Welcome back to Riverside Strong. We've spent the day learning how to recognize symptoms of a heart attack and finding out what happens once you arrive at the hospital. But what happens next? Once you leave the hospital after a heart attack, how do you continue the rehabilitation process to get better and prevent another heart attack? While it can be stressful, with Riverside's team of experts, you are not alone. They can help guide you on the path to recover and prevent another heart attack.
About a month and a half later, I'm back in again. And the doctor says, well, it clogged up again. He said, and it came back with a vengeance. So they go in and they clean that artery out and put a stent within that old stent.
There are often questions in regards to medications. Will I have to take these medications forever? What will my exercise abilities be in the short term, in the long term? And I think also a very important question that is often asked is, how will this affect my life moving forward?
And of course, I'm on new medication for cholesterol. I'm on blood pressure medicine. I went to cardiac rehab, which I recommend. The first phase of it is in the hospital while you're being treated. That's phase 1. Phase 2 is going into an outpatient type setting and working on the machines for 30 minutes. They hook you up to monitors. They take your blood pressure and they weigh you and measure you, and you exercise for 30 minutes on those monitors to make sure that everything is working right.
So nutrition is very important to cardiovascular health, as well as health in general, because the foods that we eat contribute to not only our health, but all of our vitamins, our minerals, our nutrients, all of those items that help with our biochemical reactions, so producing energy, for storing protein, for healing, but then also it can work against you if we're not eating a well-balanced diet. So a healthy diet is a good balance of fresh fruits and vegetables, whole grains, lean meats, protein and fish, healthier fats, and then the little balance of the stuff that may be not so good for you. After a heart attack, what's most important is, number 1, to get your strength back. Eat the wide variety of foods, the fresh fruits and vegetables, the whole grains, the lean